Okay. Greetings and good morning, everyone. My name is Juan Phelan. I work at the Department of Health as the Maternal and Child Health Care Coordinator for Home Day State. My presentation for today is on the postpartum care. This presentation is part of the JAGDAL project for specific co-learning towards resilient health system. So the mission of the Division of Primary Healthcare is to protect and promote health and well-being of Frontalians through culturally acceptable and appropriate public health approaches and preventative health services that are sustainable, equitable, affordable, and accessible to the people of the goal of the Well Baby program is to maximize the likelihood of a normal growth and development of babies or children 0 to 5 years of age to enable them to achieve their upcoming potential. So the responsibilities of the Well Baby or Well Child care programs are to be fully aware of current statistics and the data on the target age group, and to maintain an accurate registry of all babies and children 0 to 5 years of age, to perform comprehensive examination, assessment, and evaluation of the growth and development of babies and children 0 to 5 years age at regular intervals. To provide support, education, and counseling to mothers and caregivers on health, nutrition, and normal child growth. Milestones to assist them to perform their parenting and caring responsibilities. We continue on to ensure babies and children receive immunizations at the scheduled age. Also to ensure babies and children receive vitamin A every 6 months, starting from 6 months of age. To ensure children receive deworming medication every 6 months as well, starting from the age of 2. Secondly, to ensure every baby or child has their motherhood or an building checked at 1 year old to rule out or confirm an union. That's to chapter that. Lastly, to identify high-risk babies or children for special care. The schedule for the Well Baby Clinic or postpartum schedule here in Pompeii may carry in different states, but here in Pompeii, the postpartum clinic for both mom and children are on Tuesday afternoons. So both the mother and child comes in to clinic 2 weeks after birth or after discharge from the hospital. The subsequent visits for the baby and mother are then different after the clinic. So it's every 2 months for the child to come and receive their vaccinations. So they receive it at 2, 4, 6, 12, 13, and 48 months. Uh, for the mother, their appointments vary. It depends on the type of um, family planning or contraceptive pills that they take. For those that are on the pills, can come in every month. Those who are receiving the injection come in 3 monthly. And then for the Jadel insertion, it's 5 years, and then 10 years for those on the IUD or intrauterine device. All right, so the forms that we use in the postpartum clinic are those shown here. So the one on your far left is the Well Baby Clinic encounter form used by the pediatrician or health assistants to guide their physical exam or their check that they do for our babies. The one in the middle is the postpartum checklist that's used by the OBGYN or health assistant to guide their check for the mothers. Whereas the last one on your right is the Well Woman Examination form used by the family planning program or physicians when a mother opts for family planning or contraception. The child immunization record or card is also used during this visit, where health assistants or the nurses will record the child's weight and as well as their next vaccine appointments. So the first thing that the doctors see for the mother are they do physical examinations on the mom, so seeing their full appearance, the mother's full appearance, check what the nurses record during the triage, and for those moms who give birth naturally, they're expected to have some fluid still left over from giving birth. So initially, uh, a couple of from birth or from delivery to about 3 to 4 days after birth, you're expected to have more dark and bright red blood on their pads, and it flows heavy like period. And then you're expected to have small clots. And then after that, about a week up to 12 days after birth, it's supposed to decrease or moderately decrease down to only just a pinkish brownish discharge on their pads. Uh, the flow is more moderate, but there should be less clotting noticed. But by the time they come for the postpartum clinic, which is ideally 14 days after discharge, they're supposed to have only minimal discharge of yellowish white discharge, little to no bleeding, no clots whatsoever, and it might last up to from 12 days to 6 weeks after delivery. One of the biggest problems here that we're experiencing in Pohnpei, and I'm imagining for all of the states in the FSM, is the anemia in pregnant women. So we're advising the mothers to take iron tablets up to 1 month even after delivery. So I showed the images up here. The image on the top shows for the mothers who give birth through C-section. By the time they come for postpartum care, they should already be healed. The C-section scar should already be healed. For those uh, health assistants and doctors advise to look out for, redness and tender spots around the scar. If there's infection, then there should be care given to the mothers. During the postpartum care, uh, the health assistants or the physicians are expected to advise the mothers to go on contraception methods, whether it be on the pill, on the injection, which can be taken every 3 months, digital, or insertion, which is given subcutaneously, uh, that can protect the mothers for 5 years. And then the intrauterine device or the IUD is up for 10 years, or they can also opt for giving out condoms for the mothers. The mothers can start these above or the contraceptions straight after birth, even if they're breastfeeding. Anemia is a serious problem amongst pregnant women or postpartum mothers. So they're advised to take the irons again up to 1 month after birth. Uh, Another advice that you can give is to recommend iron-rich foods, which can include leafy green vegetables like kale, spinach, or broccoli. Uh, the red meat can be found in fish, beef, or pork, uh, beans, and tofus. The do's and don'ts for during postnatal period are to ensure personal hygiene at all times, both for the mother and for the child. To use sanitary pad and change as needed. Ensure proper hygienic care of the vagina, and use warm water every time using the bathroom. Avoid food restrictions and eat more nutritious meals. Take iron and folate tablets and vitamin B1 up to 90 days after delivery. Avoid sex within 6 weeks after delivery. and seek services from skilled health professionals if you're experiencing any of the danger signs during postnatal period. The danger signs will be listed later during the presentation. For the postnatal care, for the pediatrician, when they care for the child during postnatal care, these are the forms that are used. So the first one was shared earlier, but along with that, we also attach the growth chart. The pink one is for the baby girls. The boys are using the blue form. So during the postnatal care, the health assistant or a pediatrician has to first go through the physical examination form and check the baby's weight, ensure that it's increasing normally, check the height, head circumference is taken to rule out any risk of hydrocephaly. And then the chest circumference, of course, it correlates with low birth weight. So that's why the health assistants or the pediatricians like to follow that as well. A special care or examination is done to the baby's entire body. So that's including the head, limbs, body, skin, genitalia, abdomen, and all their refluxes are also tested during the postnatal care to rule out any other diseases. During this visit, if there's a need for further care, then they're given follow-up appointments. They're given medications during this visit as well. And they're also advised to bring their baby back for vaccination. Okay, so during the postnatal care, there are early screenings that are done. So one of the screenings is the hearing screening, which is done by the EDI staff. EDI meaning early hearing detection and intervention. So the hearing screening is done ideally 8 hours before discharge or after birth before discharge. But for those babies who did not pass that hearing screening in the hospital, they're then referred for a rescreen during the postnatal clinic or the well baby clinic. So I listed the 136 EDI goal, which is to have the baby be done with screening by 1 month of age, have the diagnosis by 3 months of age, and then start interventions by 6 months. And other referrals or follow-up must be made for babies who are presenting other anomalies such as musculoskeletal anomalies. Could be things like club foot, cleft palate, also heart murmur, and eye and vision problems. During the well baby clinic or postnatal care clinic, health assistants are strongly advised to advise the mothers on the breastfeeding, exclusive breastfeeding up to 6 months of age. During this visit, health assistants or nurses are also advised to assist mothers or babies who may still be having difficulty latching on to breastfeed. And then it's also recommended that during this visit, health assistants or physicians must counsel mothers and explain the benefits of breastfeeding, both for the baby and the mother as well. So some of the benefits of breastfeeding for the mother are to decrease breast and ovarian cancer risks, stimulate and release of hormones that are relaxing and calming. Emotional bonding that occurs during breastfeeding is crucial for brain development and developing security and love between the mother and the child. Then there's the postpartum weight and pain management for the mother. Breastfeeding is ideally less costly. So there's no need to purchase formula and purchase bottles for bottle feeding. And it also serves as a natural contraception method for the mother. Benefits of breastfeeding for the baby is to boost immunity. It's a natural nutrient that can't be found in any formula. There's a lesser chance of diseases and infections for the child. It stimulates brain growth and it's easier to digest than the formulas. Some of the danger signs during postnatal period. So if the mother or the child is experiencing the following at any time during their postnatal period, please urge the mother to visit the hospital or the nearest health facility. So for the mother, the postnatal danger sign for mothers are high fever, rapid and difficulty breathing, severe headache with blurred vision, convulsions, heavy vaginal bleeding, painful vagina with foul-smelling vaginal discharge, redness and tenderness over breast and nipples, difficulty to urinate or urinary incontinence. So that's inability to hold in their urine. For the baby, the danger signs are high fever or low body temperature, fast breathing, severe chest indrawing with wheezing sound, no spontaneous movements, bluish discoloration of lips and extremities, yellowish discoloration of eyes, palms, and soles, poor suckling, redness and pus around the cord or umbilical cord, and then there's the eye redness and pus discharge from the eye. Information about immunizations. Vaccines saves lives by developing protective antibodies within the body before diseases strikes. Therefore, it's important to vaccinate your child on time according to schedule. Some diseases can result in permanent disabilities in some children, and it can also cause death. So that's why vaccinations are important. All ingredients in vaccines are safe and effective. Multiple vaccines at the same time are totally safe, and it makes sure your child is protected sooner rather than later. After vaccination, your child may develop fever, redness around injection sites, and lethargy. But they're totally normal and can gradually go away within a few days. Child nutrition by age groups. So from 0 to 6 months, it's advised to exclusively breastfeed your child. Ensure skin-to-skin contact with your baby after birth as it helps early initiation of breastfeeding and helps to stimulate milk production, flow, and bonding. Immediate and early initiation of breastfeeding within 1 hour of delivery is beneficial for the baby and the mother. Breastfeeding contains necessary antibodies and nutrients essential for newborn babies. Ensure exclusive breastfeeding, only milk, nor fluid, no water, till your baby becomes 6 months old. Give frequent breastfeeding until your baby is satisfied. So that's around 8 to 10 times per day. Each time or each breastfeeding session should last up to 15 to 40 minutes. If the baby is still small, your baby needs more frequent breastfeeding. So to ask skilled health workers on more advice on the frequency and the amount of times you should be breastfeeding your baby. So continue breastfeeding even if your baby is sick or has diarrhea. From 6 months and above. So at this time, children should be starting complementary feeding. So that means breastfeeding along with semi-solid foods. So at this time, child should continue breastfeeding along with other foods until your baby becomes 2 years old. Start feeding semi-solid foods slowly to the child. So, for example, semi-solid foods can be mashed or blended foods of fruits, vegetables, such as carrots, potato, or sweet potato, mixed with boiled fish, chicken, beans, and eggs. All of these needs to be mashed or blended. Strict hygiene during food preparation is extremely uh, strong recommended. So wash hands before preparing the baby's food. Ensure that the utensils that you use to prepare the child's food is also uh, clean. It's recommended to add only small amounts of oil and salt to the baby's food, but to start off with one type of semi-solid food uh, for the first 2 to 3 days. After they've gotten used to that food, then you can recommend the mother to try different foods. So, feeding frequency of semi solid or solid food depends on the age of your child. 2 to 3 times a day for 6 months and 9 months old, along with your breastfeeding. 3 to 4 times a day for 9 month old up to 2 years and above. Uh, Semi solid foods along with breastfeeding is recommended. To summarize my presentation, the takeaway message that we would like for our health assistants to inform our uh, families, our postnatal mothers or postpartum mothers, is that hygiene is crucial to prevent disease and infection. Mothers to continue taking iron tablets up to 1 month after delivery. Please recommend that exclusive breastfeeding is the best choice for the baby. And then advise the mothers to come to the hospital as soon as possible if she or the baby are both are experiencing any of the mentioned danger signs. So the good nutrition food is important for mother and child to stay healthy and prevent them from diseases. Lastly, is to vaccinate your child on time. Thank you for listening.